For today's update, we have 55 new cases to report today, test positive here in British Columbia, bringing our total to 2,053. That includes 803 people in Vancouver Coastal Health Region, 918 now in the Fraser Health Region, 119 on Vancouver Island Health Region, 168 people in Interior Health Region, and 45 people in Northern Health. There are no new long-term care facility outbreaks today, and 12 now have been declared over. We have 391 cases that are associated with our long-term care facility outbreaks, and that includes 20 long-term care facility or assisted living facilities that are active currently, and 3 acute care units. Right now, we have, as people are aware, a number of community outbreaks as well, and the majority of our cases today come from the ongoing investigations in 2 poultry-producing plants, including 46 cases now associated with Superior Poultry, and that's the largest increase related to that today, and 34 cases related to United Poultry. We have an additional 2 people who have been identified, inmates at the Mission Federal Correctional Facility in the Fraser Health Region, bringing the total there to 120 inmates and 12 staff. In terms of our cases, we have 94 people who are in hospital right now in British Columbia, and of those, 37 are in critical care or ICU, and 1,190 people have fully recovered from COVID-19. Today, we unfortunately have another 2 people who have died from COVID-19, bringing that total to 105 here in British Columbia. And today is the National Day of Mourning. As you may know, this is a time to honor those who were killed, injured, or made ill as a result of workplace injuries. And we remember friends and loved ones, and we include a number of the people who are in our COVID-19 as well. We are reminded that everybody, and how important it is to have good health and safety conditions in our workplaces, and that everyone deserves a safe workplace, as well as a safe home and a safe community. And the work that we're doing over these last few months reminds us of that. With this pandemic, COVID-19, our number one focus has been on protecting the health of everybody here in British Columbia. Every decision, every order that we've done, every restriction is based on that risk assessment that we have been doing, and focused on breaking those chains of transmission of COVID-19 in our families, in our communities. And we use science, and we've talked about that quite a lot, as much as there is science, and then we use our experience and the need that we have, the modeling that we've been doing, and the evidence that is accumulating from around the world on what's the best way to control this virus in our communities. That is an ever-evolving and changing thing, and you will know that our recommendations and the things that we have implemented across BC and, of course, across Canada and the world have changed as we've learned more about this virus. Currently, whether it's in the provincial ministries, returning travelers, or businesses, we absolutely recognize that the actions we have taken have significant social, financial, emotional, and health impacts on all of us. And we have been trying to use the data and the science that we have to find that delicate balance of making sure we have just enough restriction that we can control this virus, but enough that we can continue to function as a community. And we've seen that delicate balance, and now we're at that point where we need to find how do we translate that into our BC plan for our new normal in the coming weeks and months. It continues to be a whole-of-government approach here in British Columbia, and I provide with my team the public health advice and the health advice. But since I believe it was on March 9th when we announced that we were implementing the government pandemic plan, all of government has been involved. And the Premier will be speaking more about this and more about our plans in the days and weeks to come. We must all remember that this is the importance of the work that we're doing and the actions that we are taking together, and particularly the importance of these actions to protect our elders and seniors, as well as those with underlying health conditions that are at the highest risk of getting severely ill with COVID-19 and being in hospital. We must continue to protect them and to protect our families and communities as we're going through this transition period in the coming weeks and months. And we need to ensure the capacity and the tools that we have developed in our healthcare system, in our public health system, are ready to rapidly respond to any increases that we're seeing, and that the outbreak can be maintained over the next few months. More importantly, we can't lose sight of the role that each of us plays. So the decisions that we each make every day makes a difference to all of us in the coming weeks and months. The personal efforts and the public health measures are directly related to bending that curve, and we've seen that, and we've seen the actions that everybody is taking and how important they are. And these actions will form the foundation of the work that we're doing going forward. So things like washing our hands regularly, making sure we're not touching our face and eyes, environmental cleaning, making sure we're cleaning places, especially high-touch surfaces, our safe physical distancing that we've all been doing, and most importantly, of course, staying home and staying away from others if you get sick. These are the core tenets that will keep us in good stead, that will keep us safe moving forward, even as we increase our social connections and we increase our economic connections and we move forward in this pandemic together. What you do does and will continue to make a difference in the days and weeks ahead. And we look forward to sharing more details around some of the modeling that we're using and the details about our plans for going forward in the coming days.